Now, good afternoon. Yes, and thank you so much for everybody who's attending. I know people are still going to be coming in. And maybe we need now to begin. We are around 7 minutes past time. I wanted us to look at a quick text, but before I put the quick text, maybe could I put a word of prayer? So let us pray. Father, Lord in heaven, we thank you so much for this opportunity to start another afternoon. The words and advice that are going to be coming from your health team. Your wisdom is going to be with us as we listen to the speaker and the presentation that she has for us. So thank you so much for this moment as we pray of this through Jesus Christ our Savior. Amen. Now, maybe I'll need us to look at just a small story that we know about in the Bible. And we're looking at a story that we get in the book of Exodus, and the chapter is chapter 12. Now, there was a number of plagues that had already gone on. Now, the final plague, which was the 10th plague, was about to affect Pharaoh and his government. And a message that was given to the people of Israel is that on their doorposts, if they smear the blood of the lamb, then they will be protected. Today we are going to be talking about a topic in relation to COVID-19 prevention, a number of things, and we're looking at a plague that has also kept us indoor. There's going to be how the doctor will talk to us, and we see, do you also have lintel and basins of blood that we can use to smear on our doorpost? Because I know one story that I've heard before is that people in Egypt, those who are not even from Israel, those who smeared the blood of that was meant to be smeared on the doorposts survived the pandemic that had come. It was picking the firstborn sons. Maybe this is the time now we should listen to a message that is going to be coming from our sister and our doctor here, the experts. They can talk to us and give us a moment. Before I start, let us just introduce our moderator, because our moderator is going to be our brother Walter Umbega, who's the head of the health department in Creta. After this, then I think I'll just have to introduce Walter, and Walter will introduce our doctor for us. So thank you so much. Walter, if you could lead us with a word of prayer before you can introduce our guest speaker.
Yeah, let's pray. Our eternal Father, our Savior and Redeemer, this evening we come before you. We thank you, we glorify your name because you have been so good unto us, O God. This evening we pray that may you open our hearts. May you help us, Father, even as we understand and discuss issues affecting us, O God. We pray that may you give us the wisdom that we need. Help our facilitator, our doctor, who is going to explain and talk more about this the disease, this virus, which is making our life, for God, which is making our life so hard. And above all, God, we pray that may your will be done as it is in heaven. For this is our prayer. We pray in Jesus' name. Amen. Dr. Bob, unmute.
Yes.
Please welcome and talk to us. It is your time.
Thank you very much, Walter. Thank you very much, Elder Stanley Mbeche, as well. I know we have been in communication throughout the week, and I'm glad and honored to be representing the medical fraternity today. You said maybe the experts, I may not be able to fill in these shoes. And I hope that the little things that we will be discussing today will have an impact in how we are going to approach the menace that is COVID-19. And I believe that we have had a lot that I'm going to talk about. We have said so much, but I also want to believe that maybe there should be a difference in how we approach COVID-19 in its entirety. So thank you very much, Walter, once again. Thank you very much from the Elders Desk. And yes, thank you. I am ready to start the presentation once you are.
We are ready.
Okay.
We are waiting for you.
Now, my presentation today will be short and long at the same time because we want to cover COVID-19, and this is information that we've been receiving for the last about 2 years, and a lot has been said. We can say so much about COVID-19, and I was talking to Rama initially, and I was telling him that maybe 1.5 hours may not be enough to talk about COVID, as a whole. But all the same, I hope that I'm going to stick to, what was given to me. And if I'll not be able to answer any of the questions or any of the concerns that you have, please write these questions down in the chat box. I'll be willing and ready to answer them at the end of my presentation. So it allows me to share my screen. Good. Now, I know I have not said my name because this first slide, I would have preempted this first slide. My name is Bob, Dr. Bob Massey. I work with AR Healthcare. I am the resident doctor and the manager at AR Nakuru. I appreciate the opportunity to be able to talk about SARS-CoV-2, how we call it in the medical terms, and maybe what everyone else calls COVID-19. Now we should be saying COVID 2021, yeah? Because it's here with us and we have to learn. Now, COVID-19, I don't know if it's moving from your end. Okay, good. Now, COVID-19, also known as coronavirus 2019 or SARS-CoV-2, is called corona because I know you've all seen this photo somewhere. You've all seen this pictorial representation in, in the media, on social media. Corona is a Latin word, and it means crown. Now, I think this is a 3D representation of what a crown would look like on someone's head. Yeah. So it is called corona because it looks like a crown. If it looked at under the electron microscope, and some changes have been happening, and we will be talking about some of the changes that have been happening to the virus, but this is what is seen when we do some of the tests that we request for as doctors. Now, what is SARS-CoV-2? It is in full severe acute respiratory syndrome, which causes COVID-19, and COVID is coronavirus disease, which was first identified in 2019. Now, from the name, you can see that it causes severe acute respiratory symptoms, yeah? By respiratory symptoms, we mean symptoms that affect the nose, the throat, and the chest finally, yeah? And we know that the ears, the nose, and the throat are all connected. It's one big T, and therefore whatever happens in the nose can also happen in the ears and the throat, and finally in the lungs. Now, it is an important disease because we know that we cannot survive without oxygen. And the lungs are our filters and they're our recipients of oxygen. And therefore, if we find a virus that affects, the chest and causes a pneumonia, then it is something to be worried of. From its beginning in 2019, it was first identified in China, and because it was causing chest infections, what we call pneumonia, yeah? It is believed to have started from animals, bats to be specific, but most rabid animals can also carry this virus. So cows, pigs, even chicken can be able to carry this virus. Most people have just thought of bats, from before, but I can assure you that most animals can be able to carry this virus, and it can finally end up in the human population. This virus is relatively new, and even the doctors are learning. So you might find that as we go along the presentation, I will keep saying that studies are underway, and we keep putting our ears on the ground to hear what the WHO is saying, to hear what the Ministry of Health is saying, to hear what KEMRI has come up with, because it is relatively new. Now, what is a pandemic in itself? This is a widespread disease that causes human-to-human transmission. That is, it transfers from one person to the next, and it affects large numbers of people, and these people have to be from different countries. If it affected Kenyans only, probably we wouldn't call it a pandemic. Yeah, if it affected, the African continent only, we wouldn't call it a pandemic, but we call it a pandemic because it has affected many countries. Right now, all countries have reported at least a case. And WHO in 2020, March, on the 11th of March, decided to just call this a global disaster, and treat it as such. Now, now that we have said that it is a pandemic and it affects so many people, how does it spread? This information has been given to us on the media. It has been given to us through the health desk in church. But we still need to know, because even after this information has been given to us, we get to a point where we suffer from information fatigue. You've been told this over and over again, and you just don't want to hear it anymore. But because we are human and we are to err, we forget some of these things. Now, if you're close to someone within 2 meters, before we would say 1.5, but recent studies have shown that up to 2 meters, if you're close to someone within 2 meters, then you can easily get the disease from them if they are infected. It spreads through droplets. Now, droplets, as I talk right now, maybe you can see a few things. And for those who cannot see, I can assure you that I'm producing thousands of droplets as I speak. When we cough, when we sneeze, when we sing in church, when we breathe heavily, we produce these droplets. Now, these droplets come from one person to the next, and they go to the next person's eyes, ears, or mouth, and when inhaled, when they are in the air. So once inhaled, it goes into the back part of the nose, where we would call, the sinuses, and it stays there for about 3 days and multiplies. And within 3 to 5 days, it starts showing some of the symptoms that we will be discussing as we move along. In indoor spaces, and this is what we've been talking about, maintaining 2 meters in indoor spaces. But we have said that this COVID virus can actually be on the air for some time, Recent studies are showing that it can be on the air for up to 6 hours. So you might be walking around and you're thinking, I'm alone here and there is no one, so I don't need my mask. Maybe someone sneezed there 2 hours ago, and some of the COVID droplets are still hanging in the air, and you breathe it in, and finally you get infected. Now, infected people with minimal or no symptoms can still spread the disease. And this is something that we all need to understand. Most people have said, oh, I do not have any symptoms, I can visit the sick, I do not have any symptoms, I can go to church, I do not have any symptoms, I can, walk around with no mask. Maybe you are asymptomatic. By asymptomatic, we mean you do not have any symptoms. Yet you're visiting the elderly, you're visiting these children, you're in contact with all these people, so you can actually spread the disease. And this is something that we all need to understand. So what are some of the symptoms that we need to look out for? Initially, we thought that COVID would only present with a fever, such that if you do not have a fever, you say, I'm totally fine, So you can also present with a cough. You can also have a sore throat. You can be tired, extremely tired, to the point where you do not feel like leaving your bed. You can have shortness of breath. You can also have a bit of sweating. You can lose your taste. You can lose the sense of your smell. You can have vomiting. You can have diarrhea. So it is not just a fever that would show that you have COVID-19. Usually in church, you would take our thermometers and screen people. And if your temperature is below 37, you feel, we are totally fine, and therefore we can hug and shake hands. It is not only a fever that denotes that one has COVID. Symptoms may start a day after exposure. So maybe you took your mask off when you're walking in town, and you breathed in air that someone had sneezed into maybe 2 hours ago, and you got infected with the disease. Even a day after, you can have symptoms, but the average is usually between 5 to 6 days. Yeah. Then these symptoms can last as long as 14 days. But then for some people, the symptoms can last for up to months. That is something we call long COVID, and I will talk about it as we move along. Now, these are some of the other symptoms that I have talked about. You can have a headache, you can have a rash that looks like almost something similar to an allergic rash, maybe on the neck. It can also present with a rash that looks like chicken pox, and you're feeling feverish and you're sweating and you're thinking, okay, so this could be just another viral infection or a skin infection, what people would call a skin disease. Yeah, yet it is indeed COVID. You can also have a stuffy nose or a runny nose. And then, of course, with these symptoms, many other diseases will also present like this. Yeah. And most people come to us and they just tell us, oh, Daktari, I have the normal flu. This is not COVID. This is just homa ya kawaida. Yeah. And they go along, their daily living activities like nothing happened. Yet they're tired and they have a running nose. For sure, it presents like the normal flu. But are you sure? Is it COVID? Are you transmitting this disease without your knowledge? Yeah. Then, as I said from the previous slide, there are people who might not have symptoms and are still able to spread the disease because the virus is still replicating much as they do not have the disease. Now, people come to us with some of those symptoms that we have talked about. But because these symptoms are very similar to other illnesses, we have to test. And that is why we are very keen on isolating the patient who comes to us. We isolate them, do the basic investigations, rule out the normal things. Because if a patient presents to me with a fever, it could be malaria for all we know. It could be typhoid for all we know. It could be the normal flu, yeah? But then we have to have the normal tests, the baseline tests, what we would call that. Do maybe a complete blood count, just look at all your cells to understand what else could be going on. Then if your basic tests are suggestive, so you've come with the symptoms which are suggestive, your basic tests are also suggestive, then we go ahead and do a nasal swab or a throat swab that will confirm whether you have COVID or not. Now, having said this, I know so many people have shied away from taking the test because of how uncomfortable it is. But then I can imagine discomfort going for about 14 days compared to discomfort that lasts, a minute or two, yeah? Then you put so many people at risk just because you shied away from taking the test because it is an uncomfortable test, because it is a swab that was inserted through your nose. Think about the many lives you'll be saving just by taking the test. So much as it's very uncomfortable, I don't believe there's any test that is comfortable. An injection is not comfortable. Doing a throat examination is not comfortable. Doing a skin examination is not comfortable. Therefore, we just need to take this sacrifice that lasts maybe a minute or two and, save a generation, so to speak. Now, after we have confirmed that indeed you have COVID, what is the treatment? There is no specific treatment per se, because most viruses do not have a specific medication. But then there are things that we normally give that will help your body to mount an immune response, which will be able to fight this disease. So other than the drugs that we'll be giving you to help your body mount a response, we're also going to be managing your symptoms. You remember the symptoms, you have a fever, we give you something to bring down your fever. So even paracetamol is good enough. You have a sore throat, we give you a drug that will soothe your throat, and will reduce the pain that you have been perceiving. You have a running nose, we give you a decongestant. Your muscles are aching, we give you a muscle relaxant. So there is no specific treatment. And that is what we all need to understand. Yes, there are drugs that have been discussed in different publications and different research papers, and I'll be talking about them as we move along. Now, people have asked about variants. What are these variants? Because once we got into the year 2021, so many people were worried because, the UK said that there's a new variant, it is lethal, Now, viruses constantly change, and so do humans. No specific human is the same, yeah? They constantly change because as they are exposed to the environment, they need to adapt to the environment, yeah? So some of the changes are what we call mutations, yeah? They change and they form a new form of a virus, which has the same characteristics as the previous one, plus something extra to make it survive better. Sometimes new variants emerge and disappear. I'll give an example. In 2006, there was an influenza outbreak, but it did not get to the point of being called a pandemic. Now, this outbreak had a specific variant of influenza called the H1N1, and I'm sure some of you have heard of this. The H1N1 came and it attacked so many people. Some people died from it. Some people ended up in, high density, ICUs and all. But others actually recovered. Therefore, some of these variants can actually be weaker than the previous one, so we do not need to worry about the variants. Other times, the new variants emerge and they persist. They last here for long. Now, multiple variants of the virus can cause COVID-19, the same disease, yeah? And they've been documented globally. Now, I'll talk about some of the few that have been documented. Now, in the UK, there was a variant that was called the B.1.1.7, B117, and it was identified in the fall of 2020, so between October and November of 2020, yeah? Remember, we kept saying that 2020 was not our year, then the virus started changing and people got scared, yeah? So in January 2021, some studies had already been done on this new variant of B117, and it showed that it had a higher risk of death compared to other variant viruses. So compared to the original one and the ones that have been subsequently identified. Why? Because it causes a greater inflammatory response in the chest, and therefore you experience difficulty in breathing more than you would if you had the previous strain. Now, the second one that was identified was the B1351, and it was different from the B117. Now, this one was originally detected in South Africa, but then the Americans are the ones who picked it and traced it to South Africa. Now, this one was identified in October 2020, but then documentation started in January 2021. So you can imagine the new variant from the UK was reported in January 2021, then the new one in South Africa was also reported in January 2021. So you can imagine the amount of anxiety that was surrounding COVID as a whole. And then finally, Brazil also reported a new variant, the P1. Now this one was identified by people in Japan who identified travelers from Brazil, yeah? And they realized that P1 also had a higher risk of death compared to the initial one. Now, do we need to be worried about the variants? Because they are variants, definitely. We need to be aware that they exist. We also need to be aware that they cause severe disease. We also need to be aware that the previous one is still there and the variants still exist and they can cause a severe form of disease. Now, other than the fact that they cause a severe form of disease, they can also, they have also been shown to spread faster, yeah? Faster and more easily. As I said, a variant comes about because the virus tries to adopt better. So if, say, it has learned that we are disinfecting surfaces, it has to make something that will be able to help it survive on disinfected surfaces, for example. And therefore, if you can't touch this surface and touch your face, then you're at a higher risk of developing some of the symptoms of COVID-19. Now, what then can we do? The same things that we were doing even before the variants are the same things that we need to do now that the variants are here. Now even more better and more compliant to all the things that the public health officers and the public health, the Ministry of Health, all the things that they have been talking about. Yeah, because you remember, if it spreads more easily, then it can get more people at the same time. And if it gets more people at the same time, then many people will need to be admitted at the same time. So then what does this mean? Our health systems are going to be strained. Say in Nakuru alone, how many hospital beds do we have? How many ICU beds do we have? Will the health system be able to manage the big numbers that will come about if we do not adhere to the guidelines that we have been shared with by the WHO and the Ministry of Health? Therefore, this is a call to everyone that the disease is here, and much as we are protecting ourselves, we need to be very vigilant to make sure that if your mask needs to be up there, it is up there. If you need to wash your hands, you wash your hands. If you don't need to visit someone who is unwell, we can support them virtually, like we're able to do this talk virtually and still deliver the information. Now, I have already started talking about some of the preventive measures. Now, why do we need to adhere to some of these preventive measures? Number one, because we want to reduce the spread of the infection. In the long run, we don't want many people dying. We don't want many people in hospital, because once the health system is overwhelmed, then it means that more people will be managed at home, and therefore the kind of care will also reduce. Now, number one, wear your face mask. And here I like adding the word properly. So many people, we've seen so many congregants coming in with their masks below their noses, on their chins. Some of them even put their masks on their foreheads, and you wonder, what are we protecting on the forehead? Which droplets are found on the forehead? Which droplets are found only, from the mouth and not including your nose, right? So wear your face mask properly. Ideally, a face mask is any piece of cloth that covers your nose and your mouth that can be able to absorb the extra droplets that you produce. Well, ideally, the best mask would be a surgical mask, and I think all of us have been able to see them around. The blue masks, some of them are black, some of them are white, but the majority are blue. Those are at least the ones that are recommended by WHO, because they protect the other person by about 95%. So you can imagine I am asymptomatic, but I'm talking to you and my saliva contains the virus, and I'm covering about 95%. Then you only have a 5% chance of doing what? Of getting the disease. Now, this 5%, what do we need to do? We now need to have the distance that we were talking about, yeah? Initially, it was 1.5, but now WHO recommends that it is 2 meters, a 2 meter distance between one person and the next. So even as we are making things in our homes, at the church and all, we have to ensure that the 2 meter rule is adhered to. If anyone has symptoms, whether it's the normal flu, whether you think it's malaria, whether you think it's just food poisoning, stay at home. Why do we insist that we stay at home? Because I'm imagining for you to move from home to a hospital, you have to use a public, some mode of transport. It could be public, it could be private. But if it is private and you're too sick, then you have to have someone to drive you to hospital. So you're exposing this person to hospital. Now you come to AR Healthcare, for example, and find children seated at the reception area, or you find old people seated at the reception area. You do not know whether they are diabetic, you do not know whether they are hypertensive, you do not know what underlying conditions they have that you could be exposing them by coming to hospital. So stay at home. And do you seek medical advice while at home? Absolutely. There are toll-free numbers, and we are also very happy to help, very happy to give our numbers at the end of this talk so that you can talk to us, so that we can advise you accordingly. Yeah, we do not want you to stay at home and suffer in silence. Stay at home, but talk to a medical practitioner so that we can advise you. We are very lucky that the government has a toll-free number that you can call, 716. It is free. just call and tell them, hey, I feel like I am unwell, I live at a certain place. They will be able to assess and determine whether, sorry for the background noise, and determine whether this mild disease can be monitored while at home or you need to be admitted. Number two, you need to wash your hands. Remember, we said everyone has to have a mask. That one is given. Then maintain your social distancing, what we would call physical distance, because we might be physically distant, but then socially you have your phone call, you have Zoom, and you can still talk to people. Continue washing your hands. I do not want us to have information fatigue, because we have spoken about washing hands since 2019, but we still insist. Now ask yourself today, how many times have you washed your hands? How many times have you washed your hands? Even if you're at home, how many times have you sanitized? And when you're talking about sanitizing, we use an alcohol-based hand sanitizer, yeah, that has at least 70% alcohol, because alcohol has been shown to kill the spikes from the virus, and therefore it cannot adhere to the lining of your nose and your throat and your chest as well. Now, you've done all these things, but you're sick, you're still coughing, you're still sneezing. Ensure that you follow respiratory hygiene. Now, what is respiratory hygiene? When you need to cough, do not cough into your hands, because you cough into your hands and the next thing would be to touch, something. So you have transmitted all these droplets to whatever else you have touched. And therefore, that means that so many things around you will be contaminated with some of the droplets that may contain COVID-19, the COVID virus. Therefore, we advise that people cough into their flexed elbows. And I have seen that so many people are trying so far, but still, old habits die hard. And therefore, you'll find someone, even removing the mask to sneeze, because you feel like the mask is congesting you. That mask is there to be able to help you sneeze in comfort and protect the next person. I have seen people pulling their masks down so that they can have a phone conversation. That window in between you talking, and pulling your mask off your nose and off your mouth can actually expose you to some of the droplets that we were talking about that could last in air for about 6 hours. So therefore, the mask does not suffocate. The mask does not reduce the amount of, how loud your voice will be. I have seen people come to our offices, and we are talking to them and they're like, acha nitoe mask tusikizane vizuri. No, we can hear you with your mask on. You can even talk with your mask into the microphone with no problem at all. So remember, all these things, we need to do them, and we don't need to get tired, because as we said, the variants are here. The disease is becoming more lethal. It is spreading faster. All the things that we were not so keen about, we need to be keen about right now. Other than that, we are also trying to at least advise that we reduce traveling. And traveling is not just, moving from here to Kisii or, Nakuru to, say, Nairobi. It also includes the little tiny travels that we do within town. So say someone has told you, oh, there's something that I need you to help me with, but you remember you're feeling unwell, or maybe you have contact with someone who is feeling unwell, whether it's malaria or any other thing. If they have not taken a COVID test, they are unwell, and it is a possibility that they could have COVID-19. So try and avoid moving from house to house. We know as Adventists, we really appreciate the time and the joy of fellowship. But then this joy can unfortunately be our demise. Then some countries have also initiated the use of vaccines. And I will be talking about vaccines at length, yeah? But then this is in a nutshell. What we have said about the mask, yeah? Wear your mask when you're talking to people, when you're having face-to-face conversations. Now I can afford not to be in a mask because I am only, talking virtually. But if it was a face-to-face conversation, definitely I'd need you to have your mask on, and I'd need to have mine as well. When social distancing cannot be achieved, have your mask on. But then where are you going to where social distancing cannot be achieved? Therefore, try and avoid crowded areas, try and avoid areas that might expose you to COVID-19. if you're in the high-risk group, and what do we call the high-risk group? Number one, people who are diabetic. And I think you've heard of Mutai Kagwe saying people with comorbidities, people with comorbidities. What are these comorbidities? So diabetes is one of them. And it's unfortunate that some of us here in church also have diabetes, yeah? And you might not know the other person's story. So you're there pulling your mask and you do not know whether if you expose them, they will actually get to survive. The second thing, the people who are hypertensive. Why? Hypertension most of the time is associated with heart enlargement. And if the heart is enlarged, sometimes it pushes extra fluid into the lungs. And when this happens, your lungs are very vulnerable. Whether you feel it or not, sometimes your heart is enlarged. You might not know that your heart is enlarged until you come to us. Then we have a look, we have a look at you, do some tests, and establish if indeed your heart is vulnerable or not. And you know that a vulnerable heart will lead to a vulnerable chest as well. The next thing, you need to have your mask on within a healthcare facility. Some people might not exactly know that they have COVID just because maybe they have a toe pain. Yeah, their toe is aching and it's swollen and they do not know why it's swollen. So they decide to come and see Dr. Bob at AR, and Dr. Bob tells them, hey, we need a COVID test. And you wonder why, what is the relationship? The new variants are now coming with very many different symptoms, which I think I mentioned before. Then if you're sick at home, and we have been blessed with families, but then in certain situations, you might find that your family, someone maybe tests positive and the rest of you are negative, and you wonder, hey, what happened? So if you have tested positive, make sure that you have your mask even at home. And I'll give an example. And I know I like giving examples because they're real life experiences. 2 weeks ago, a patient came to us and they asked us, they told us that everyone had tested positive in their family apart from him. And now he had started experiencing a bit of muscle aches. And we're like, okay, so we will do the basic tests. And if it is highly suggestive and due to the fact that you have confirmed contact, then it is highly likely COVID and we will test you, all right? So we finally tested, he was indeed positive, all right? But then he told us that the experience at home, because it is something that he had already done over and over before, and that is what just, was the default. You get home, you hang your mask, because home is where corona it does not exist, yeah? Because, these are the people I know, and therefore they might know, they can't have corona, This is my elder, he probably does not have corona. You do not know where Elder Mbeche was, for example. You do not know where Dr. Bob was. You do not know the number of patients Dr. Bob has seen who might have COVID, yeah? And therefore, even while at home, if anyone is unwell, make sure you have your mask on until you're at least 2 meters away from them, or you're in different rooms. Remember the 6-hour rule? Some of these droplets can actually be in the surface, the air surface, and you might get the disease then. Then, when you're caring for a sick person, have your mask on. It is unfortunate that some of our family members have been exposed to the disease and some have been able to actually, recover from it, and some haven't. But even as you care for them, for the ones who are on home-based care, make sure you have your mask on. Remember, masks alone do not protect you. They should be combined with all the other things that we have talked about. You care for this person, you have your mask on, you wash your hands, you maintain your distance, you make sure that you're sanitizing if your hands are not visibly dirty, yeah? Now, we've talked about this. I will not belabor this point enough, but then the last point here is what I really need to insist, that we need to minimize gatherings with friends and family. I know being the social beings we are, we really appreciate being in groups and prayer sessions, and we want to have discussions, and maybe Zoom is not enough, and you realize, let me just come see you, maybe we meet outside. Even that outside can be a period where you have a face-to-face interaction, however brief, you can still get exposed. Now, for people who are working, we have been hearing, Mutai Kagwe and the entire Ministry of Health saying working from home. And we also understand that there are people who cannot work from home, people who sell merchandise, people who have to have, physical work to be done for them to get money. And we understand that all these are possibilities. But for the ones who can actually work from home, if you have been, blessed with these machines that we are using right now to, deliver talks and all, please use them to be able to work. Myself, probably I cannot work from home because we cannot see patients from home. But for you who can, make sure you take advantage of this, because I can assure you that all medical practitioners wish that they could actually work from home, because the disease is here and it is spreading like a wildfire. And it is not to scare people, just to call people to realize that, yes, indeed, if things can be done from home, you need to do them from there. If you can avoid going to that hotel, try and avoid. If you can avoid going to see, your friend, try and avoid, because you'll use public transport or you'll use, your private car, whichever means, you will be in contact with people and you do not know whether these people have the disease or not. Now, it happens that unfortunately you've been adhering to all these things, and your family, unfortunately, someone tests positive, right? The first thing you need to know, do not panic. We have seen that high levels of stress can actually reduce your immunity, and you'll not be able to fight this disease better. Therefore, do not panic, do not be afraid. I know so many people have said, don't tell people, oh, it is no one's fault really, yeah? Because, if you have been adhering to all the things that we have been talking about, and, you unfortunately get the disease, then ideally, you do not need to panic, because if you panic, then you increase your chances of getting a severe form of the disease. Then second thing, you monitor the situation. Ask yourself, do I need to be in hospital? Do I need to, can I manage from home? Do I need to be tested? Do my family members need to be tested? All these are questions that you'll be asking yourself as you monitor the situation. Say you have young children. Say you've been living with your parent who is old, or you're living with your parent who has a comorbidity. Monitor that situation, then get in touch with your local health provider. Now, here in Nakuru, it might be difficult, for you to have a specific doctor who follows you up. Now, this is when you call the 716 line, and it is functional. I can assure you that it is functional. And some of our patients have come to us and they told us, I was actually assisted by the public health officers from a certain group. And it was very helpful. Now, what are the things that you need to monitor while at home? Number one, you need to listen to your symptoms. Literally, just listen to your body. And this is something we've been talking about even with some of the healthcare providers we work with. Listen to your body. Are you experiencing difficulty in breathing? Are you running short of breath? Is your head aching to the point you cannot see? Have you experienced what we call a syncopic attack, meaning have you fainted? Have you lost consciousness? Some of these things need to be monitored in hospital. If any of these things have happened, then you do not need to be at home. Yeah. Now, this is when you can actually take yourself to the hospital. Yeah. Now, I know most people have been afraid before to talk about, their family members who have tested positive for COVID. People are just speaking in whispers. And while you're speaking in whispers, you're exposing more and more people. Because if someone does not know you're unwell, they'll probably come see you. You'll probably have, social gatherings. You'll probably, not take care of yourself properly. Yeah. And therefore, if you are COVID positive, declare it to your family members. They need to know so that they too can protect themselves. Then, if you're positive, you need to have access to essentials. Yeah. Maybe have someone bring you food, water, and household supplies so that you do not have to go, to purchase these things. Many a times I've called out patients, meeting them maybe in the supermarket and maybe the day before we diagnosed COVID, and they're thinking, I thought we discussed this and we said that you need to be at home. So you can imagine how many people have been told to stay at home and are not staying at home. Yeah. So have someone bring you food, water, and household supplies, and medicines, if at all, to maybe just take care of the symptoms that you have. I'll be talking about the food that we can eat to be able to help you build your immunity and fight it better. Right. Now, when caring for a sick person at home, now it's unfortunate that your mom has tested positive. Your mom is maybe hypertensive diabetic and they are 80 something, or even you are hypertensive diabetic, or you have an underlying disease, you're maybe battling with cancer, or maybe you had a stroke, some time back. What do you need to do for these patients? Number one, we need to limit the number of caregivers. We understand that you love this person. We understand that you'd want to stay with this person for so long and to show them, that you're there and you care for them. But then in the process, you expose yourself and you expose all the family members that you will be in contact with after visiting this sick person. So we insist that one person takes care of the sick person and makes sure that he is not in contact with the rest of the family. Yeah. So if you can get maybe one room where the sick person will be and maybe an adjacent place where the other person who will be giving the care can be, and then the rest of the people are away. Most people have actually sent people to their villages, once one person tests positive. Whether this is good or bad, I might not be able to give you complete answers, but I must insist that before you send, maybe people to the village, make sure that they all test negative instead of carrying the disease from, Nakuru all the way to wherever your village is. Number two, do not allow visitors to the sick person's room. We want to say pole, we want to, show our love, but then do we have to be physically there? Probably not, yeah? So just make sure that even as we fellowship, even as we visit with the sick, ensure that you are adhering to some of the protocols that we are talking about. Number three, have dedicated utensils. I know this might be difficult, yeah? You have dedicated utensils and, spoons and cups that this person uses, such that we reduce the number of people who are exposed to the disease, because the sick person is touching the same cup and all that. Then, as I said before, wear a mask when caring for this sick household member. Try and reduce the number of times that you are in this sick person's room. You remember that the sick person will be in one room for about 14 days. And it is difficult. It is difficult to be in isolation because remember, we are social beings, yeah? But then try and limit the number of times you are in this room because you're also exposing yourself, yeah? Then, of course, after visiting with this person, after giving them water and food and all that, make sure you wash your hands. And at this point, I will not say sanitize, I will say wash your hands with soap and water, yeah? Because at least this is a confirmed contact, and soap and water has been shown to work better than even hand sanitizer. Now, make sure that this sick person is resting well at home and that they are well hydrated, they're drinking enough water. We are talking about 3 liters, yeah, slightly more than what they would drink normally, because remember, this person probably has a fever. Therefore, they are losing a lot more water than they would, if they did not have COVID. Number 3, fruits that are rich in vitamin C are also very important. At least studies have shown that vitamin C boosts one's immunity and you're able to fight better. So what are some of these fruits that are rich in vitamin C? So you have oranges, you have lemons, you have pineapples, you have mangoes. Green leafy vegetables also have vitamin C. Make sure that the sick person is eating these. And I know sometimes the appetite might be really bad, but then you can even squeeze the juice out of this. Just make sure that they're taking, these fruits and they're drinking enough water. While at it, make sure you monitor the symptoms. Remember when we said you listen to your bodies? Now they are sick, they are already confirmed. Monitor their symptoms. Monitor if the symptoms are getting worse. Are they able to talk better? Do they look stronger? Are they eating better? Are they breathing with difficulty? And if so, are they turning blue at the tips of their fingers? Are their eyes, popping out as they're trying to breathe in? Those are some of the things that you need to monitor. But then we also insist that if you have a COVID positive patient at home, you make sure that you're monitoring their vital signs. What are these vital signs that we're talking about? Number one, you need to monitor their oxygen levels. Now, there is a small machine, a very small, affordable machine that we call the pulse oximeter. You can get it from any pharmacy, you can get it from any chemist. Make sure that if you're monitoring any sick person at home, you've bought this so that you can use it every now and then to make sure that the oxygen levels of the sick patient do not go to low levels which are below maybe 90. Yeah, and if they go below 90, seek medical advice immediately. Monitor their blood pressure. We have said that they are hot and therefore they are burning and they are losing more water. Make sure that their blood pressure is also at least normal. And you can, even as you're buying these blood pressure machines, you ask, what is the normal? But then you remember, if you're on home-based care, you are in contact with a healthcare provider, at least a nurse, a clinical officer, or a doctor who can be able to assist, when some of the danger signs or some of the warning signs actually show their heads. Now, you have this sick person at home, you have people who want to come visit, and they've been telling you, screen and make sure that, all these people do not have COVID. What is this screening? Now, screening is done at entry points most of the time to detect whether someone is unwell. The simplest way of screening that we are using as of now is through temperature monitoring, because at least 86% of people will present with a high fever. Yeah, but then you remember that once you have a fever, you can pop paracetamol and then come to me, so that when I take your temperatures are normal, So screening alone, might not be the most effective way. Screening through, temperature taking might not be the only way to screen. There are questions that you can ask. Have you been in contact with someone who has tested positive? And if so, are they on treatment? How long ago were you in contact with them? And all that, yeah? Now, you've heard about contact tracing. We talk about contact tracing, including the things that, we do at church. We visit with people who are unwell and they tell you, I have been told that it is pneumonia, and they do not disclose. Like we were saying earlier, people refuse to disclose because there is a lot of stigma surrounding COVID. But honestly, really speaking, really and truly, do you leave your house in the morning to go and say, now today I'm going to pick COVID? Yeah, it is no one's fault. I am sure you try your best, and unfortunately you get the disease. Disclose to the people around you, disclose to the people you work closely with, disclose to your church if the church supports you, because the church will want to come and visit. Yeah, just tell them, people, I am unwell, I am away, but I am recuperating well, but I do not need visitors because I am positive for COVID and I do not want to expose all of you. And if in the unfortunate event that you have been exposed and you're one of the contacts, number one, of course, listen to your body, look out for any symptoms, and then if need be, if you have any symptom, quarantine for at least 14 days. Yeah. Now, we have said that it is very difficult for you to isolate for about 14 days, because you can imagine 2 full weeks. You're not meeting anyone, you're just eating alone, you're sleeping alone, you're not moving around. And being social beings, we get stressed out. Yeah. So how then do you cope with this stress? I know some of my colleagues who are in this forum will tell you that I always talk about the mental health well-being before anything else, because this is the most important part when it comes to managing COVID-19. Like we said, there is no specific medication. Yeah. So we'll only be managing some of your symptoms, right? But you remember that the mental well-being will affect how well you're able to fight this disease. All right. So things that you can do to reduce stress while in that room: sit down, take in deep breaths. We call them breathing exercises. They really help. Inhale, hot water. It doesn't have to have anything, but you can add ginger and garlic and all those things Studies are showing that they have, natural decongestants, and they can actually help to open up your chest, yeah? And then most of the time when you're in that room, what are you reading? What are you exposing your mind to? Are you just watching videos that are showing, the many people who are dying from COVID-19? Are you just reading, propaganda and all those bad things that, people are saying about COVID-19? Occupy your mind with things that are positive, things that, will encourage you and will help you fight the disease faster and better. All right. Now, there are so many rumors on social media. Therefore, you need to gather the right kind of information. Where do you gather this right kind of information? Talk to Walter Mbega. Tell Walter, hey, I want to talk to a clinical officer. I want to talk to a doctor. I want to talk to a nurse. I just need to know if this is true, for example. Yeah. Then Walter can reach, any of us, and we will be able to help you where needed. All right. Then exercise has also been shown to help, because exercise helps your body produce a certain hormone that we call the feel-good hormone, also called cortisol, which will help your body increase the immune cells that will fight the disease better. Eat healthy. You eat your vegetables, you eat your fruits that are rich in vitamin C, you drink a lot of water, and rest. All these things will just help your body fight the disease faster. Now, these are just pictorial representations of what I have talked about. You clean your hands with soap and water, and make sure you cover your nose with, while sneezing and coughing, either with tissue, and you only use this tissue once, yeah? You don't cough into your tissue, then almost immediately you're holding the tissue on your left hand and shaking people's hands. This way you're spreading the disease. Then you also need to, sorry, I'm hearing some background noise. Am I clear?
Yes, you are clear.
Thank you. Thank you, Walter. Thank you for that confirmation. Now, then you also need to thoroughly cook your food and make sure that, nothing that is eaten raw has been eaten without being washed. Then avoid unprotected contact with farm animals. And we have talked about this. Remember from my second slide, I said that even animals can be carriers to this disease. Yeah. These are just images that I picked from the WHO. And just to insist on the importance of maintaining clean hands before touching surfaces, and after, taking care of a sick person, or once you're from maybe a social gathering, inevitably you will touch surfaces that are exposed, that someone maybe laughed into, and there are droplets there. Now, there is a five rule, the 5 moments of washing hands that the WHO provides, but I've added a few others, yeah? That you need to sanitize your hands after coughing or sneezing, when you're caring for the sick, before, during, and after preparing food. We always need to remember this, because remember, this person is eating a lot of fruits, yeah? All right? And therefore, some of these fruits are eaten. Of course, most of them are eaten raw, yeah? And therefore, you need to make sure that your hands are clean before you handle some of these fruits. Before eating, after toilet use, definitely, not because of just the things that you could be exposed to while, in the washroom, but also due to the fact that you are touching many surfaces, flushing the toilet, you're touching tissue and all that. Now, after using this tissue that we're talking about, make sure that it is thrown in the bin directly. Unfortunately, as Kenyans, our social characters and our social behaviors have been wanting for some time, and COVID has really exposed us, yeah? And I say this kindly, but I also call upon everyone to make sure that they take care of the environment, even as they take care of themselves. We are saying one use tissue, then you throw, but where do you throw these things, yeah? Then you protect others from getting sick. From this photo, you can see that there are children here. There is an elderly couple here. And then there's one with a not so old child, yeah? If you're in close contact with them while experiencing some of the signs that we have talked about, you are exposing them, yeah? Then avoid spitting in public, if you have a fever or cough, we have said seek medical advice early from the phone, then you will be advised whether you will need to go to hospital or otherwise. Now, I've talked about food safety. I will just go through these things very fast because I don't want us to suffer from information fatigue. But then traveling. I like pausing on this slide every so often because sometimes traveling to us might just mean going to Kisumu or going to Kisii or, but what is traveling? Even the little travels that you're doing within town can expose people. So let us travel only when it's necessary. Yeah. I know sometimes we want to condone with, the bereaved and we want to be there for them. But I also believe that we can have very many ways to condone with the bereaved without exposing them further or exposing yourself. Now, there are so many rules that we can say when we can talk about, because there is inevitable travel. Maybe you lose a loved one and you have to go condone with the family, or you have to go, for the funerals and burials. While traveling, avoid close contacts. At least most of these public transport providers have ensured that all the WHO guidelines and the Ministry of Health guidelines are adhered to. Yeah. But even as you travel, even as you're 2 meters away from the next person, make sure that you're cleaning your hands frequently, carry your own little sanitizer. Now they're very affordable, yeah? Then you also avoid touching your face, yeah? Touching your nose, touching your mouth, because you do not know what you have touched that would, be exposing you. Then while coughing and sneezing, as we have said, and we still insist that you make sure you use a tissue, or you have your mask on at all times so that you do not have to, sanitize every now and then after sneezing or coughing. Now, while traveling, if you become sick while traveling, inform now maybe our conductors or maybe the traveling crew to be able to assist you. Yeah, then you'll be given medical attention if you seek it. Remember, if you're quiet, you will suffer in silence. Yeah, until you're very sick. I will insist at this point that if you're sick and if you actually think that it is COVID, do not hide. Yeah, because most times we find people coming to us when they're really unwell and they have been unwell for, say, a whole week and they've not sought any medical advice. Please come to us, call us, we will advise you. Do not be embarrassed. There's nothing to be embarrassed about when it comes to COVID and some of these diseases. And for us to be able to protect each other, we have to have communication. We have to talk. We have to tell the other parties that we are unwell and therefore you want to protect them. Now, there are some of these questions that we have asked. Yeah, as you notice, we are almost we're going towards the end of the presentation. There are frequently asked questions, myths that you've heard about COVID-19. I prepared some, and if you have any, please continue putting in the chat box. I'm seeing that the chat box is already full with questions. Just make sure that you ask any question that you might have so that we, at the end of this talk, you have all the information that you need. Now, a question is asked, does the new coronavirus affect older people or are younger people also susceptible? Everyone is susceptible to the disease. Unfortunately, older people are also the ones who live with pre-existing conditions, things like diabetes, heart disease, asthma, and I think I've talked about this, in my previous slides. They appear to be more vulnerable. And therefore, we have to make sure that even as you think maybe you are a young person and therefore you're immune to the coronavirus, make sure that you're protecting that older person, that other person who has, a pre-existing condition. The WHO advises that all age groups, everyone, takes a step towards protecting themselves and protecting the people that they are in close contact with. I hope I have answered that question well. Everyone is susceptible. Everyone can get sick. We have lost people in all ages, young and old alike. Therefore, you're not invincible. Just protect yourself and protect the people around you. Now, since COVID came, I know people who sell oranges and lemons and garlic and ginger have really done well, yeah? But can eating garlic help to prevent infection with the coronavirus? It's a healthy food, yeah? And it may have some antimicrobial properties, meaning it might kill a few bacterial cells here and there, a few viruses here and there, but there is no evidence so far that shows that garlic can actually kill the coronavirus. I know that this can be a disappointing, piece of information because people have been talking about steaming and, making sure that you have your concoction of dawa, but there is no specific evidence. However, people who have experience in alternative medicine have insisted that indeed garlic can help and therefore there is no harm, yeah, because it has some antimicrobial effects, then take it, there is no harm. Remember, too much of anything can also be dangerous. If you have issues with, say, acidity, you also do not want to take a lot of garlic, or if you have, if you're allergic to garlic, for example, some of those things that you need to be careful about. Now, can pets at home spread the new coronavirus? Currently, there is no evidence that dogs and cats can be infected, yeah? But then it is always a good idea to wash your hands with soap and water after handling pets and making sure that all the other bacterial things other than the coronavirus that could be, you could expose yourself by handling these pets, just to prevent yourself from getting them. Number 4. This was an old question, but I insisted that we needed to have it here because now that we are working from home, we are really exchanging a lot of, luggage, and we are receiving a lot of packages and letters and all that. Is it safe to receive a package from, say, China? Right now, not China, because the disease is everywhere, yeah? Is it safe to receive a package? Yes, it is, yeah. But as we said, after receiving a package, you have to ensure that you wash your hands because the people who are handling the packages might be the ones who are exposed and not necessarily from where the package was, because the virus does not survive for that long on surfaces. Now, I will talk about the periods that different surfaces can have the coronavirus. Okay. Now, finally, let us talk about the vaccine. This is a very hot topic, and I remember Elder insisting that we should talk about vaccines, and I hope that I'll be able to answer most of the questions that were asked. I will be talking about the myths versus the facts that are available. Now, the first thing, the first myth is that COVID-19 vaccines are not safe. And I know this is almost what everyone is saying. Oh, they're not safe. People have developed it so fast. The scientists have been so fast. Oh, how sure are we? We can't be the guinea pigs. All these things have been said, yeah? But then the WHO mentioned and put COVID as a pandemic because of the number of people, that were dying and the number of people that were actually suffering from the disease. And therefore, a lot of resources, were sent into making sure that these vaccines are done well and go through the trials and the phases of trials that they are supposed to go through before they're released in the public. So yes, due diligence was done. No shortcut was taken. Yeah, it is a very strict process, and all these things were followed. It's only that all the resources, billions of money, was pushed towards making sure that we have the vaccine. So yes, it is safe, and all the vaccines that we have currently locally, the AstraZeneca one, and I think recently you've seen the new one, are all safe. Yeah. Maybe one is slightly safer than the other, and we will talk about that as we move along. The second myth, that you can get the COVID disease from the vaccine, absolutely not. This is a myth. It's not a fact. And the fact is that the vaccine does not give you a live virus. You're not given the virus, so that your body mounts a response. No, you're just given parts of the virus, yeah. such that your body is able to learn how to mount a response. Yeah. And then once you're exposed to the disease, then the antibodies that you form can fight this disease. Yeah. Now, once you get the vaccine, you can get a few side effects, and I'm sure some of us here have gotten the vaccine, and they may have experienced some of the symptoms, like maybe fever, chills, a bit of fatigue, muscle aches. Some of the people have also reported diarrhea and vomiting. It doesn't mean that you have COVID disease. No, it is just your body mounting a response, and an immune response will always come with some of these symptoms. Yeah. Now, at this point, I need to insist that after getting the vaccine, at least the one that we have locally, AstraZeneca vaccine, you're still exposed to the COVID disease for up to 14 days before your body is able to learn how to fight the disease. So even after you've gotten the vaccine, make sure that 14 days later, you're still protecting yourself. You're still, washing your hands. You still have your mask on. And even after the 14 days are over, you do not just walk around like, do you go to war without an armor really? Yeah. Because you have a sword. Yeah. So let us continue protecting ourselves even after getting the vaccine. Now, we've said that the vaccine is safe. We've said that you cannot get the disease from the vaccine. Now, there's also an assumption that if you've already gotten the COVID-19 disease, then you shouldn't be vaccinated. This is also not true. And the reason we say so strongly that it is not true, we have seen that there is a small window period. WHO says about 90 to 120 days where you still have some of the antibodies that your body formed to fight the disease. And within those 120 days, you might not get the disease if you're exposed. But then what happens after these 4 to 6 months are over? Yeah, will you now continue going to the battlefield without an armor because maybe you got beaten in the previous war, So speak to your doctor, verify all the information that you might have. Yes, you might have gotten the vaccine, but we have seen very many patients coming in with the second infection, the third infection, or maybe within the 14 days, they're still not yet well, yeah? So after you're well, within 14 days of being well, make sure you get the vaccine, yeah? And it is locally available. We will talk about some of the areas in Nakuru where you can get the vaccine. Another myth, the fatality rate, the death rate, that is, of COVID-19 is so low. Why should I be vaccinated, yeah? I don't probably need to be vaccinated because it's only 1.7% of people who die from COVID. But do you know whether you'll be the one to die? Do you know whether you'll be the one to end up in ICU and maybe recover? Do you know whether you'll be the one who will be asymptomatic? Because of this lack of knowledge, it is always better to ensure that you are safe and that you've taken the vaccine to protect yourself, your family, your colleagues, and the community at large. Remember, vaccination is voluntary. We are only encouraging you to do this because we have seen the benefits and we have ensured that the vaccine is safe for everyone. Another myth, there is no need for mask wearing or social distancing after receiving COVID-19. I think I've talked about this, but we know that vaccines are effective, but you do not need to stop, taking care of yourself or, Then the other thing is that some of these vaccines are not 100% effective. You get up to 90% protection, but you can have that, 10% chance of, getting the disease once again. So continue wearing your mask, continue practicing your social distancing, ensure that you observe enhanced hygiene routines, making sure that you protect everyone around you and you protect yourself away as well. Now, the final myth, that the vaccine will alter your DNA. And we have seen so many conspiracy theories doing rounds on social media. We've had so many people talk about, the vaccine and how, it's the worst thing that could happen to the human, Now, two of the first COVID
having a problem with the network.
Have we lost her?
Yeah, it looks like
Yeah.
there's a problem with the network, huh?
Yeah.
Yeah.
Yeah. But somebody can try to talk to her to find out what is happening, huh?
Yes,
Whoever
yes,
has the contact,
yes.
yeah.
Yes, I'm doing it right now. Doctor, we lost you.
Sorry about that. I think electricity issues, but we were just about to finish. I'm glad that that happened at the second last slide. Yeah, so I'll just share my presentation once again and continue from where we were. Yeah. So, yeah, we were talking about the second last myth, that people with underlying conditions should not be vaccinated. This is also not true. Most people with underlying health conditions are the most vulnerable ones. So we need to remember that these are the people that we need to actually put on the forefront of making sure that they are vaccinated. The Ministry of Health currently has ensured that at least people who are above 58, whether they are teachers or not, whether they are doctors or not, as long as you're above 58, then you can easily get the vaccine from all the places that the Ministry of Health has provided. You need to follow the local health authorities guidelines. If you're not above 58, then do not go. Do not go, because you're taking the space of someone who probably, if they get the disease, will die from it. Yeah. So let us just follow the local health guidelines. Speak to us. We will advise. We will tell you whether to go for the vaccine or not. Now, a question that I received earlier. I had a stroke maybe 5 years ago. Am I eligible to getting the vaccine? Number one, we have seen people talking about clots and the probability of the vaccine giving you clots and all that. If you had a stroke, then you're probably on medication and you're making sure that you're taking your medication consistently. And therefore, this vaccine will not alter anything. And I'll mention this drug because it's a very important drug in the management of people who have been hypertensive or people who've had strokes from before, aspirin. Make sure you are on your aspirin and make sure that, everything that you're supposed to be doing is being done. If you are hypertensive, if you got the stroke because you are hypertensive, make sure that your hypertension is well controlled. If you got the stroke because you're diabetic, make sure that your sugars are well controlled. Then you get the vaccine. You are not at a higher risk of developing maybe clots and anything of the sort. Yes, there are studies that are underway in Germany and Netherlands and New Zealand to just ensure that the AstraZeneca vaccine does not cause an increased risk of developing clots. Yeah. Then the other thing, COVID-19 vaccines are not effective against the new variants. Absolutely not. So far, from the data that we have, it has been shown that yes, indeed, the vaccine is effective even to B117, B1135, and P1. Yeah. So yes, it is effective. So whether you get the one from South Africa, whether you get the one from Netherlands, you're still at least protected for up to a certain percentage. Now, this is my final slide. The myth is that severe side effects of the COVID-19 COVID-19 vaccine are common. There is some truth, but then the thing that makes this a lie is the word severe. The side effects are mild, just pain on the site of injection, a bit of a fever, you might experience a chill, but all these things last for about 24 hours, 24 hours. And after 24 hours, all the symptoms are gone. If you are diabetic, it can alter your sugar levels by about a unit. So if your averages are usually 7, you can have maybe an average of 8 on the day that you got the vaccine, because your body is mounting an immune response. It is firing up to be able to fight to fight the disease if you're ever exposed. You might also experience a bit of muscle aches, a bit of joint aches, a bit of fatigue, but these are not severe side effects. And therefore, do not be afraid of the vaccine just because there will be a fever that will last 3 hours. I'm imagining a fever that lasts about 3 hours versus a fever that would last 14 or more days from the disease, or maybe pain at the injection site. If you cut yourself today with a piece of nail, with a nail, yeah, the first thing you'll do is to run to the hospital to get the tetanus vaccine. True or false? So why is it that we are so afraid of the COVID vaccine, yet it has the same side effects that the tetanus vaccine probably has? For our young children, even as we are giving you maybe a vaccination against measles, we empower you as the father or the mother, and we tell you that there could be a fever, there could be a bit of crankiness, the child may be a bit fussy, but all these things are expected. If we expose a copy of a virus, a copy of a part of the virus to your body is bound to make a response. Studies are also showing that if your side effects were a lot, then it means that you're able to fight the disease even faster if you're exposed to it. Yeah. Let me clarify that. I might not have been very clear. If you have very severe side effects, yeah, and I'm calling this very severe in quotes because I don't believe a fever and a chill can actually prevent you from getting the vaccine and prevent the probabilities of even dying just because you are afraid of experiencing muscle aches. If you have a severe form of side effect, then it means that your body is very fast in mounting a response against the COVID copy that you have been exposed to. So thank you very much for providing me with this opportunity to talk about COVID, to talk about the vaccines, to talk about the myths and the misconceptions that are out here. And asanteni sana. I will take any questions as we move along. Thank you. Over to you.
Thank you. Thank you, Doc. We have so many questions on our chat.
Yeah.
Maybe we can respond to a few.
Okay.
Starting from Paris Kemdo. Paris is asking.
Yes.
But I think you have also answered. Can anyone be infected?
Yes. And that is a question that always comes up whenever we are talking about COVID. Just like malaria, you can be reinfected. Yeah. If you're exposed to the Plasmodium parasite, yeah. If you're exposed to the Anopheles mosquito, for example, you can get the malaria disease, right? So if you're exposed to the COVID virus, the coronavirus, then you can be reinfected. However, there's a window period, yeah, within which you cannot get the infection. And WHO is putting it between 90 to 120 days. Initial readings were saying that this period would be up to 6 months where you cannot be reinfected. But in my experience, on the front lines, we have seen very many people coming back with reinfections even 2 weeks apart because they got unwell, went to isolation, and then almost immediately they went back to the office where some of the people did not quarantine or some of the people did not isolate. So the virus was just still doing rounds, you know, so they got infected. So yes, Paris, you can get infected, reinfected.
Thank you. Caprice is asking, what if you are given a vaccine, then you get COVID-19? Is that possible?
Hey, Caprice, hi Caprice. You can get the vaccine, and the vaccine, as I said, is not 100%. You're protected up to 90 to 95% after completing the second phase of the virus. Of the vaccination, yeah? After the first phase, at least for the AstraZeneca one that we have locally, you have up to 65% protection. So yes, Caprice, after the first vaccine, you can get COVID. But then after you complete the second phase of the vaccine, then the chances are very minimal that, you know, you could get the disease. We have seen a few people reporting, having gone through the 2 phases of the vaccine and get the disease, but the chances are very, very minimal. Yeah, up to 5% compared to what was 100% initially.
Yeah, thank you. Eric Angwen is asking, why is it that when vaccines arrive, the positivity rate is worrying?
Okay. Now, Eric, I think the thing we need to understand here is that the positivity rate is not connected to the fact that the vaccine got here. It is connected to the fact that now the disease is mutating and there are new variants that are now spreading easily and faster, all right? And it was just about the same time that we also were getting the vaccine. So that was a coincidental happening that when we were getting the vaccines, the new variants also came, and those variants are spreading easily and faster and affecting a huger population. Therefore, the positivity rate, yes, is worrying. Even in Nakuru, you can already tell that initially we were just hearing of numbers, but now we know of people who are really close to us, people, our sisters, our brothers, our elders, our pastors. All these people are now getting the disease because of the new variants that we're getting. You remember we are still traveling. The international travels are still, on. And as much as they have the 72-hour certificate, what if they got the vaccine within the plane, So it is not about the vaccine. It is just that the variants came at about the same time that the vaccine was coming. Yeah.
Yeah, thank you. Again, Percy is asking, is the cloth mask protective? Maybe we can join together with what Elda is asking. Elda is saying, can you really emphasize the recommendation against use of masks with exhalation valves?
Yes.
Maybe you can answer those two.
Yes, thank you, Walter. And I think I mentioned this when we were talking about wearing our masks well. Yeah, from the material of the mask, the cloth mask. Initially, WHO would say that anything in front of your face, including a handkerchief, including a bandana, can actually reduce the chances of you spreading the droplets. But then it has been shown that the protection that you get from a cloth mask is very minimal, because the viral particles can still penetrate through the cloth because the cloth does not have a filter like the surgical mask. The surgical masks, if you cut across them, you will notice that they have 3 layers. The internal layer, which is the absorbent layer, as you speak, it absorbs, your saliva. And then the middle layer, which is the filter, which now filters out viruses and bacterial cells. And it is very tiny, and it has been shown to actually catch some of the things that, you can get exposed to. And then now the final layer, which is almost, if you pour water, you can see water, like dripping off, because it does not absorb any extra droplets that you could be exposed to, to now the internal bit. Now, that said, we advise that if you cannot get a surgical mask, which is what is recommended, just cover your face with anything. It is better than nothing. But the better one would be getting a surgical mask. And we know that at some point they were unavailable and they were very expensive, but now they're very readily available and they go for 2 shillings. Some of them go for 5 shillings. Make sure that at least you get one surgical mask. Ideally, it's supposed to be a one-use mask, one-time use. But then we understand that because of resource constraints, we can actually wash some of the masks. Dip in jik, hang it under UV in the sun, and at least you're able to reuse this mask. So yes, if you're going to the public and you only have a cloth mask, you're better off not going, But if you have to, you're better off having it than not having a mask altogether. While answering that question, just allow me to answer this question as well. Whether, the N95 with valves, I think we have seen them, The white ones with a yellow thing right here that, opens up as you breathe in. Right now, the WHO has recommended against using the masks with valves. Why? Because that valve does not have a filter, and as you breathe in and out, it removes all the air. Yeah, breathe in, breathe out. As you breathe out, it pushes the valve, and the valve exposes the next person to all the things that you could be breathing out.
Thank you. There's also another question I think you covered in your presentation, but you can make clarification. What are the symptoms in children?
Okay. Now, and this is something that we have discussed with our colleagues and we have discussed with the medical fraternity. Among children, it is very difficult for you to exactly tell whether it's the flu, whether ni baridi tu, whether it's, asthma, whether it's exposure to dust and now they're sneezing. But then all those symptoms, sneezing, running nose, cough, fever, reduced play, reduced feeding, especially reduced feeding. For children, that feeding actually can really show you whether a child is sick from a disease or not. But then you also realize that in children, they will also have reduced feeding if they have an intestinal infection, a stomach infection. They will also have reduced feeding if they have malaria. They will also have reduced feeding if, so that means that it is not very specific, but some of the signs that we need to look out for are the very signs that we need to look out for among adults. Now, for children who are below 1, maybe you cannot tell, whether they've reduced in playing and all, but their fevers will always be high. There will be reduction in feeding again. They'll not be connecting to the external environment. By that, you know how we goof around with children and you want them to smile, they'll just be looking at you, without making any changes. Walter, I know you're following closely, maybe no changes on the face, yeah, not connecting with the external environment. All those are some of the signs. We are calling upon parents to make sure that if you feel like something is wrong with your child, then probably something is wrong with your child and you need to bring them in. For children, we cannot do the phone consultation. We are asking you to come with your child. We will give you a room, and most hospitals will do this. We will give you a room separate from everyone else where we will be able to at least examine and know whether indeed this is COVID pneumonia or not. Pneumonia in children is very common, yeah, very, very common because of how short their necks are and the distance between their nose and the chest, yeah. So if they get exposed, anything that could give them a nasal infection can give them a pneumonia. So yes, look out for all the symptoms that you'd be looking for among adults, but the unique symptoms among children will evolve around playing, connection to environment, and feeding.
Yeah, thank you, Getty, for that question. We also have another question from Elder Ogwiri. He's asking, can I take prescribed medicine for COVID together with Apple medicine at the same time?
Okay. Now, Elder Willie, I am happy that you've asked that question, yeah? Because so many people are trying many things, yeah? There are people who have come, they've come to me and they've told me, I have taken dawa ya mitini shamba. It's something my grandmother used to give us, yeah? And it would clear almost everything. But now, remember, COVID-19 is relatively new. SARS-CoV-2 is different from the previous coronaviruses that we had, all right? So no studies have been done, even on this herbal medication, to make sure that, we know whether some of these herbal drugs can work. However, studies are underway to ensure that the drugs we are giving you, vitamin C, zinc, azithromycin, and all the drugs that you'll be given by your doctor are actually showing that they have some effect on the virus. So if you're taking a drug that already has shown that it has an effect on the drug, what benefit will you have if you add this herbal medication? Much as you've trusted it for the longest time, there is no evidence, therefore do not use it. Then you also remember that our bodies work like machines. We have the liver, which metabolizes, some of these drugs. So if you expose it to things that could actually strain it, you could actually be causing liver damage without your knowledge, kidney damage without your knowledge. And I'll give an example. Our counterparts in Baringo, have been shown to have increased cases of hepatitis because of the increased use of, herbal medication together with the medication that we give in the hospitals. So Elder Willie, I would call upon, you and everyone else who would want to use the herbal medication to at least use what has been tested and proven, instead of things that maybe we might not have information on as at now.
Yeah, thank you. We also have another question from my elder Nyangara. He has asked so many questions, but I think the others have been answered. Maybe we can clarify this one. Do we have any known cases of serious side effects of COVID-19 vaccine from other countries around the world?
All right. Thank you, Daktari. Thank you, Dr. Nyangara, for that question. I will give the information from different continents. So let me start with the Americas. The Americans are using the Pfizer vaccine. The Pfizer vaccine has been shown to have a slightly higher efficacy compared to what we are using here locally, which is the AstraZeneca vaccine. Now, the Pfizer vaccine has also shown very good side effect profile. And by that, I mean that it has very minimal side effects, if any, So most of the people will only have pain at the site of injection and a bit of fevers and chills, and that is it. However, even with the Pfizer vaccine, there are people who have had what we would call syncopic attacks. They faint after the vaccine. There are people who are allergic to some of the contents that have been used to make the vaccine. So including people who are allergic to gluten. Gluten is found in wheat, and people who are allergic to albumin, which is found in eggs, So they might have a flare-up of their allergies, So that is what has been reported in the Americas, both South and North. Let me go to Europe. For the AstraZeneca vaccine, Europe at least the European countries have used AstraZeneca, because of the proximity to the UK. So importing is cheaper and it's easily available, right? But then in the Netherlands, older people above the age of 62, there was a percentage up to 0.3%, 0.3, I will insist, 0.3% experienced a bit of clotting of blood. Now, 0.3% of the population above 62 is a very small number compared to the millions of people who have been vaccinated. As at now, 6 people in the Netherlands alone, out of the 12.6 million people that they have vaccinated, have reported to have clots. One unfortunately passed on, because the clot was thrown to the chest. But then everyone else, 6 out of 12.6 million, currently have the active thrombus, we would call it thrombus, and there are medication to counteract that. So at least that is the information in the European countries. In Africa, then I'll talk about Asia. Asia is using a different vaccine altogether. In Africa, Ghana and South Africa are also using the AstraZeneca vaccine, But then South Africa recently brought in the Pfizer vaccine. And I don't want to go into the details because I don't want to lose anyone. But then it has not been shown that anyone who has been vaccinated in the South African country and in Ghana to have had very severe side effects. So the vaccine is safe among Africans as at now. In Kenya, no one has reported currently, out of the population that we have vaccinated already, none has been reported to have died from the vaccine or to have had any severe side effect from the vaccine. So it is safe. It is safe to get the vaccine.
Yeah, thank you. We have so many questions, but we will try to answer all of them, if not leaving few. My elder Maranga is asking, do asymptomatic COVID-19 patients necessarily test negative? I think that question is important, considering that most people are asymptomatic.
Yeah, asymptomatic people, as I said from the presentation, are still capable of shedding the virus. Okay, so they are infectious, much as they do not have any symptoms. That's the first fact. The second fact is that they do not test negative, they test positive. For us to even say that you are asymptomatic, it is because we have tested you and we know that you're COVID positive, but you do not have any symptoms. Then we call you asymptomatic. So you will test positive, but you will not have any symptoms. All right. So that's the second clarification. And yes, you can still shed the virus and still spread the disease. Yeah. Yeah.
Yeah, thank you. We also have another question from my lecturer, Dr. Muya, is asking about the vaccine, but that one has been answered. So we jump on and we'll go to the next. I think Elder is also asking, but Elder, we have answered about this negative impacts of COVID. That's the side effects. I think Dr. has talked about them. We go to this one from Dorot Soching. Is asking, when you test positive, taken medication, then after how long do you consider yourself safe from spreading? I think you have answered.
Yes.
But you can
I'd
clarify.
like to just say something small about that, yeah?
Yeah.
Initially, we were working with the magic number 14, yeah? And we would say that after 14 days, the virus has already done the full circle and you're no longer infectious, yeah? But then after further investigations and further studies, it showed that up to 10 days, after 10 days, you can actually be safe, yeah? But as long as after the 10th day, you do not have any respiratory symptoms. And by respiratory symptoms, I mean you do not have a cough, you are not having a running nose, you're not having a sneeze. If you have a cough and it's on the 11th day, you're still infectious. So you have to wait it out till the 14th day. However, there are people who have what we call long COVID. Now, long COVID is a scenario where even after 14 days, you keep testing positive. And some people, even here, have tested positive more than once, up to 3 times, yeah? But then, at least from studies, we are seeing that after the 21st day, as much as you're testing positive, because now you're testing positive because of the small little tiny copies of the virus, after the 21st day, even if you test positive, you can be safe to mingle with the public. Remember, even as you're mingling with the public, have your mask on, keep sanitizing, keep maintaining social distance to be able to protect everyone else.
Yeah. Thank you. I'm jumping some questions because they have already answered. Yes. So let's answer this one from Peds again, but it is important. Why is the so-called vaccine so hard to get?
Vaccine?
Yeah.
Okay. That is an interesting question, yeah?
Yeah, but
because it is said, why is it that the so-called vaccine, yeah? So I can already tell that is, I think we need to talk after this, yeah? But all the same, the vaccine currently is unavailable locally. Well, it is available, but the government brought in a limited number of doses to be able to do the first phase of immunization or vaccination. Now, the people who are targeted were put into consideration, all right? So people who are in the front lines, those are doctors, clinical officers, nurses, people who work within the healthcare facilities, all those are the people we needed to prioritize. And secondly, our teachers, our lecturers, because all these people interact with so many people, high traffic areas, so these people also needed to be put into consideration, and they were. Then finally, as the president announced last week, people above 58 and people living with comorbidities. So if you look at this population, of course, it will not be the 50 million Kenyans that we are, yeah? So there is a limited supply, all right? However, the government is doing this in phases. I'll give information from the US. Currently, the US has completely, fully vaccinated up to 16% of their population. Now, if you know the population of America, you can actually tell that that is a huge number. But then in the bigger scale of things, 16% out of 100%, it's also, a tiny population. So we are calling upon everyone to be patient, to be able to just wait for, the government to be able to roll it out, because these things are also very expensive to acquire. And the private facilities have not been given the mandate to also acquire for themselves. So we are entirely reliant on the government. Yeah, so that is why it might be slightly unavailable. But Paris, we can talk after this.
Yeah, thank you. Steve Dorothy is asking, is it a myth or a fact that the virus thrives in cold weather, hence they need to keep warm?
Okay, so most of these viral infections thrive better below the temperature of 16 degrees. So that is a relatively cold weather, yeah? And that is why you notice that during the cold seasons, there is a surge in the numbers of even influenza, the common cold, respiratory illnesses, yeah? Because most of the respiratory viruses thrive better at the temperatures of 16 degrees. So yes, keeping warm can actually help you prevent the virus from, replicating faster in your body, yeah? Then secondly, you will also notice that during the cold weather, people with allergies sneeze a lot, right? They cough a lot. And therefore that means that the virus is easily carried from one person to the next, yeah? So those are the two reasons why during the cold weather, we see a surge in the numbers of COVID.
Thank you. I can see we just have 6 minutes, but we cannot miss to answer these two. What are the signs and symptoms that I could have a clot?
Okay, signs and symptoms that you could have a clot. Okay. Now this is dependent on where the clot is. Yeah, the clot can be lodged anywhere in your body. I'll start from the feet as we move up. Now from the lower limbs, that is the feet and the legs, there will be a bit of swelling, there'll be a bit of pain on your calf. The calf is the muscle right behind your knee, what people would call maswembe. There would be pain right there. There would be a shiny appearance, yeah. There would be pain as you walk, and some people might even experience difficulty in walking altogether. For the upper part of the lower limbs, that is the thighs, you could experience a bit of pain around the inguinal area, and that is the corner between your trunk and your legs. There could be pain around that area, swelling of your thighs. All those things can actually can actually show that there could be a clot. As much as I will insist that it is rare, yeah, it is very rare. Yes, that it is a possibility. Now, for the chest, there could be difficulty in breathing. You could experience sweating, an increased heart rate, shortness of breath. You wake up at night you feel like you're running short of air at night. You feel like when you're lying flat, you're running short of air. All those are things that can show that there is a clot. If the clot is dislodged or lodged in the brain, then it would present like a stroke, yeah? So that would be weakness on one side, maybe loss of, vision on one side, or maybe deviation of your mouth on one side, hypersalivation on one side, yeah. But remember, it can affect both sides. So you could have reduced functionality of the brain altogether if the clot is lodged in the brain. I will insist this is rare. It has not been documented in Kenya. It has only been documented in Germany and the Netherlands. And studies are still underway. But even then, the population that has reported clots is very minimal compared to the numbers of the people who have actually benefited from the vaccine.
Yeah, thank you. Someone is asking, can you share the slides?
Yes, we will do a Word document and maybe share with the chat, yeah? Then we can make copies and share, yes.
Thank you. Doctor, we have seen your question, Vivian, but I think they have been answered. Willis, thank you. Maybe this one, the last one. How can you advise a person who is experiencing symptoms such as lack of taste, smell, and some broken nose? Can it be COVID-19 or a common cold?
Okay, good. Now, I mentioned that some of the symptoms that COVID presents with will also show in some of the diseases of the upper respiratory tract, yeah? So if you have a common cold, you could experience a running nose or a blocked nose. However, the lack of sense of taste and smell is almost unique for COVID, yeah? It has also been seen among people who have maybe allergies, like sinus issues, and then over time they slowly lose their sense of smell. But then what happens overnight? You've never had issues with your sense of, smell or taste, and then the next day you cannot taste a thing. That is highly likely COVID, yeah? And therefore, those are mild symptoms of COVID, and they should get in touch with their medical provider or call 716. Or if you're not in a position to do that, start taking zinc and vitamin C to just help your body fight the disease faster before it gets to a severe form of disease. Yeah.
Yeah, thank you. Maybe the last, can you share Mercy's contacts for any further consultation? Someone is asking for the contacts.
Absolutely, we are here to help. I will, I think, Walter, I can give you the go ahead to share my contacts. You can drop me a message. A message is better than a phone call for when I am seeing patients. Yes. Thank you.
Thank you. Also, you said the contacts of Dr. Thank you for the question. Thank you, Dr. for the presentations. But because of time, I want to hand over to Stan, and I think back to Gift for a photo of thanks. But before that, I want to maybe make a comment. Let's not be agents of stigma. I know there is so much stigma associated with the COVID, but maybe, who knows, you may be next victim, because it's not that one is fault to be COVID positive. So let's be a brother's keeper. Let's support those who are positive, because we don't know what's next to us. And most important, let's not fear, because the book of Psalms 46, verse 1 says, God is our refuge and the strength, a very present help in times of trouble. Therefore, will not we fear, through the earth be removed, and though the mountains be carried unto the midst of the sea, God will take care of us. Thank you. Back to Elder Stanley.
I have been very much educated today, and it's exciting to see how many people have been in. I'm quite grateful that we've seen on the YouTube wall, we've seen people all the way from Mombasa, and we have people here even from our neighboring churches, and we thank them so much. We may recognize the presence of Elder Nyangara, who's with us here, and Charles Bosiro, so thank you so much for being with us here. We'll also need to thank Simon Otieno, who's actually joining us at YouTube from Mombasa. I know there are people from Kindu Bay who are here, and thank you so much. This has attracted a number of people, and this shows the interest of people and what is really going on. Doc, we are so grateful that you responded to this. You can tell that this is really a matter of concern. The questions are so many. Now, I'm going to be saving all these questions here, share them with you, Doc, and Dr. Karama also, so that we see how much more can we explore in the questions that people are asking. This is really an area that has worried a lot of us. And that's good. Doc, the first thing you said is, let's not be afraid. This is, it's a disease like any other. So our responsibility doesn't stop by us not talking about it. Talking about it, I think, is part of the psychosocial therapy you talked about. Just starting from saying that I'm feeling unwell is a beginning. It also offers protection to the members that are around, telling them not to come to see us. Maybe this is when we will understand what is happening to us. As it was far back then, last year we were talking about it, and I could walk to your clinic. Though later I don't come to the clinic ever since you started wearing the way you were out there.
Don't come.
But this this is a moment like no other, and it's good when we start opening up. Back then, HIV had this kind of stigma, and we've gotten so used to hearing about it. Now we are looking at an infection again that is peaking another level of stigma. We thank you so much for what you've done for us. We thank you, Walter, for accepting to actually have a health talk on a Sabbath school afternoon.
Yeah.
We didn't have anything for the afternoon, let's be honest. So
We need to have more.
I want to hand over this to the superintendent of Sabbath school so that he can do a good vote of thanks. And maybe we'll end this with our elder in charge making a comment and praying for us as we close this session. So, Gift, it's up to you now.
Okay, thank you very much, Elder. I don't know if you can get me loud and clear.
We can.
Yeah. Today has been amazing. I want to thank God first and foremost. Yeah, it has been a long day, but God has been faithful. Allow me to thank all of you for being part of today's program. Today we have exceeded the expectation we had with regards to the numbers. From divine hours, pardon me just a second, please.
You're getting lost. Come closer to your mic.
I've cleared it. Okay. So today we have exceeded the numbers than we had expected. I think from our online platform in totality, we have had around 300 people from morning hours, that is Sabbath school, to right now. So I think God has been faithful. Allow me to also thank the speakers of the day, beginning with Gertrude Jepkoskei, who led the children's sermon, Elder Tom Nyarunda, and also Daktari Mercy Bob. It has been a good day. You have been insightful, and may God bless you all so much. Allow me to also thank the behind the scene team, that is the communication department, and the team, your team, Stanley. May God bless you all so much. So finally, we thank also the Sabbath School Council for the coordination and everything they have done to make this day a success. Back to you, Stan.
Gift. Talk to Elder.
Oh, are we losing Gift?
Oh, Gift is done. He handed back to you.
Oh no! Oh, he's done. So Elder Elias, we've not heard from you the whole afternoon. So we wanted you to close this for us with a prayer and a comment.
Thank you very much, my brothers and sisters, and particularly our guest speaker, Dr. Mercy, who has been extremely informative in terms of enlightening our congregation with particular reference to the information that we need to have in order to be better managers of the challenges of COVID-19. Sister Mercy, may God continue to bless your work and the work of your hands as an intellectual and as a scholar and as a practitioner in the area of medicine. Many of us are grateful about the information that you've shared with us. On behalf of the church, I want to express my appreciation to all of the members that have participated in this particular program. Daktari, please I hope you'll still feel indicted to have us call you back again so that maybe you can exploit many other areas for which I think the congregation is yearning to have more information.
Thank you.
Yeah, thank you very much. We can now pray. Let us pray. Our God and our Father, we thank you because of your love for humanity. We thank you, my Father in heaven, for the potential endowment that you've given to each one of us in the service of humanity and for the glory of your name. Even as we continue, my Father in heaven, to face the tribulations and trials in this world, because these are the last days, oh dear Father in heaven, we pray that you may continue to protect us from any calamities and pestilences, oh dear Father in heaven, that we witness in these last days. We thank you, my Father, because of the edification that you've given your church and the fraternity that exists among the brethren in your church. We pray, oh my Father in heaven, that you may continue to shower us with your blessings, so that whatever we do, whatever we say, oh dear Father in heaven, and whatever we think, my Father, may be important in the glorification of your name. Thank you, Jesus, because of the Sabbath day. Thank you for allowing us to worship you in truth and spirit. Continue to take care of us now, even as we get into the other programs in different parts of not only this country and elsewhere. This is our prayer through the name of our Lord Jesus Christ. Amen.